I'm Clarissa. I work with Southern Seven Health Department, and today we are going to talk about infectious disease. Yay! I know everybody's super excited about that. The 4 topics we're going to cover is what are bloodborne pathogens, standard precautions, exposure control plan, and post-exposure and what to do after that. Here are our course objectives and what we're going to be going over today. To sum up what bloodborne pathogens are, they're the bacteria and viruses that are found in your blood and other secretions that carry viruses that could potentially make you sick. Things like HIV, hepatitis A, B, and C are all things that we're going to be covering. HIV is human immunodeficiency virus. It's a virus that attacks the body's immune system. If 1 or 2 more compromising illnesses comes upon you, then this could potentially lead to AIDS, which is a lifelong illness, as well as HIV is already a lifelong illness. Hepatitis A and B are hepatitis strains that do have a vaccine and are vaccine preventable. And then hepatitis C can potentially be an acute thing, as well as being a chronic virus. So making sure that we are mindful of where these are and the differences between them. And we'll discuss that here in just a second. Being a bloodborne pathogen, it can be easy to share these illnesses through use of needles and also through sexual contact, and as you can see in some of the descriptions. But next we'll talk about how common HIV is. In 2019, it was shown that HIV has infected and impacted more than 38 million people across the globe. 1.8 million of those were children under the age of 15 years old. There are differences in the strains of hepatitis that we have. Hepatitis A, B, and C are liver infections caused by 3 different viruses. Although each can be caused of similar symptoms, they are spread different ways and can affect the liver differently. Hepatitis A is usually a short-term infection and does not become chronic. Hepatitis B and hepatitis C can also begin as short-term acute infections, but in some people the virus will remain in the body, resulting in a chronic disease and long-term liver problems. There are vaccines to prevent hepatitis A and hepatitis B. However, there is no vaccine for hepatitis C. So where are these pesky things located? For hepatitis, mostly hepatitis A can be found in the stool and can actually be a foodborne illness as well. However, with B and C, blood of people who are infected, semen, other bodily fluids. Now that we've talked about where they are located, now it's time to talk about how they are transmitted or passed from person to person. Most common is vaginal and anal sex with someone who has HIV without using a condom, taking medications to prevent or treat HIV. Anal sex is riskier than vaginal sex. Sharing injection drug equipment with someone who has HIV. If your status is unknown, you need to treat this like the person does have HIV. Mother to baby during birth. However, the use of HIV medications and other strategies have helped lower the risk of mother-to-child transmission of HIV to 1% or less in the United States. There are other forms of passing this on, such as an accidental needle stick, having oral sex, which is rare, or contact between broken skin, wounds, or mucous membranes and HIV-infected blood or blood-contaminated body fluids. Again, rare, but still possible. Hepatitis A can be transmitted or passed from person to person via anal, oral, and vaginal sex, caring for someone who is ill, using drugs with others, contaminated food or drink. Again, this is the one that can also be a foodborne illness, so just keeping that in mind. Hepatitis B can be passed from birth from infected mama to baby, sex with an infected partner, sharing needles or drug prep equipment, direct contact with blood or open sores of an infected person, also exposure to an infected person's blood through needle sticks or other sharp instruments. So that's where our healthcare workers especially need to be cautious in that respect as well. One thing to note is with Hep A and Hep B, those are both vaccine preventable illnesses. However, hepatitis C can be an acute or a lifelong illness that is not vaccine preventable. So we really want to be mindful of the transmission, because this especially cannot necessarily be reversed. So, sharing drug injection equipment, sex with an infected person, and also unregulated tattoo or body piercings. So, hepatitis C can spread through all of these different transmissions, plus more, but these are just the most common ways that hepatitis is transmitted. Now we're going to transition to standard precautions and what we can do to protect ourselves. Here are some of the few clips of things that we're going to be discussing. Needle safety is very important, and let's explain why. We want to protect ourselves by only using a needle once. We do not want to share needles. We want to dispose of all sharps material properly to save us from a possibility of infection. Also, to be mindful of others as well, making sure that we're disposing of them in a biohazard box, or if we have a needle drop site like we do at Massac County at the Sheriff's Department, but making sure that there aren't just exposed needles that are being thrown in the garbage or on the street. If you need to, put it into a plastic bottle and throw it away like that. But making sure that all needles are capped or contained before disposing of them. And then being cautious of accidental needle sticks. That's going to be super important too when we're talking about disposing of all sharps material properly. So if you can look at this picture too, to the side, a new needle is limited imperfections, has a very sharp tip. However, the more that a needle is used, the more opportunities for bacteria and viruses to be right by its side. You can even look after the needle has been used 6 times, where it is curled under and shards of metal are starting to flake. Again, breeding ground for germs, bacteria, viruses. So be safe, especially with needle usage. Part 2 of how we can protect ourselves with bloodborne pathogens. So they can live on surfaces where blood is present. So if there's an accidental blood splatter, spill, or cut, make sure to clean all surfaces that were soiled with blood with a disinfectant to avoid transmission, especially if it is not your own blood. This can help mitigate transmission of bacteria and viruses through the blood on surfaces. Part 3 is where we are wearing protective equipment as needed, especially if we are working in a career or profession where you may come into contact daily with bodily fluids. Make sure to wash your hands with soap and water and use gloves as appropriate as a standard precaution. Part 4 is making sure that we are practicing safe sex. This is huge. So abstinence or not having sex at all or any sexual contact is the best protector against sexually transmitted infections or diseases. So birth control pills do not prevent sexually transmitted infections. Condoms kept on all the way through sex can help prevent the spread of HIV, Hep B, Hep C, and other sexually transmitted infections. Condoms made of lambskin, sheepskin, and other natural materials do not protect you from getting HIV, HPV, HCV, and other STIs. The reason is because the pores are so big that those viruses are so small that they get straight through those pores in the natural material condoms. For oral sex performed on a man, a non-lubricated condom is recommended. For receiving oral sex for women, should use a dental dam without any holes or tears and should not be reused. Spermicides also do not prevent from any sexually transmitted infections. This method only helps prevent pregnancy. Female and male condoms should not be used together. This increases the likelihood of tearing. Also, there's no such thing as doubling up on condoms to make you safer. Only use one male condom if you are using a male condom. Now that we've talked a little bit about safe practices and safe sex, it's now time to implement this to an exposure control plan and how we can prepare to protect ourselves before the possibility of an exposure. The best way to prevent Hep A or Hep B is to make sure that you're vaccinated. Typically, these vaccinations are given as an infant. However, if you do not have Hep A or Hep B in your shot record, you are able to get these vaccinations as an adult. Even though the best way to prevent hepatitis A and B are through vaccination, it's also important to make sure that we keep a plan to protect ourselves, especially for looking out for hepatitis C and HIV. We need a plan to protect ourselves and others. We do not need to share needles. We do need to plan to practice safe sex, clean surfaces with disinfectant should a blood spatter happen, and knowing your status. Knowing your status for hepatitis C as well as HIV is important. Getting tested for HIV regularly if engaging in high-risk behavior that we talked about earlier will be helpful. Planning ahead to continue with safe sex and needle practices will also be helpful as well. Let's talk about post-exposure. So this is typically the moment where people have their awe freak out moment. So should you have a possible exposure to a bloodborne pathogen, it is important to have a plan. We need to be aware. We need to know when to test. We need to limit risk behavior while waiting to test or waiting for results. And we also need to monitor our symptoms. Some of the signs and symptoms for hepatitis A, B, and C are very, very similar, so that's why they're all listed together. There is some differences for HIV, so we'll talk about those separately. But for hepatitis A, B, and C, fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, diarrhea, clay-colored stool, joint pain, jaundice, which is the yellowing of eyes or skin, or even no symptoms at all. With HIV, typically there will be a fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. So those are things to be aware of. Again, you might not have any symptoms at all. So it's important to know when to test. So when we are deciding when to test, we need to look at the window period for each infection. So in medicine, the window period for a test is designed to detect a specific disease, and this is the time between first infection and when tests can reliably detect that infection. So for hepatitis A, if we think we were exposed today, we would need to wait 15 to 50 days to be tested. And that's the window period for hepatitis A. That's usually drawn through a blood test. Hepatitis B has a little bit longer of a window period, from 45 to 160 days. And that one's also usually tested with a blood test. There's a 4 to 6 week window period for hepatitis C. This one can routinely be tested every 6 months, and this one's also by a blood test. HIV, its window period is 2 to 6 weeks and can routinely be checked every 3 months or so. But this one's also most commonly tested with a blood test. So that is going to wrap up our conversation for today. I hope you are now able to describe a little bit more about what bloodborne pathogens are, and even though they are so small that we can't see them with our naked eye, that we know that these are things that can really impact our lives. We know standard precautions. We know when we need to use them. Making sure that we aren't sharing needles, making sure that we're using safe sex practices, making sure that we're wearing gloves if we are in a healthcare field or in a field that puts us into contact with bodily fluids. Making sure that we know that we need to have a plan in place to control exposure, but also a plan in place to make sure that if we are exposed, that we know exactly what to do and how to get help. We also need to make sure that we're going to be open and honest with our primary care provider, physician, that if we are engaging in any high-risk behaviors, that we need to be regularly tested. Here are my citations, and I hope you guys have a great day.